Good afternoon, Campbell Macroney. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your roleplay.
Hello, Mihiraa. My name is Ryan. I'm one of the nurses caring for your baby. I can see this has been a worrying time, and you've been so strong. It's completely normal to feel anxious about taking your little one home after surgery, so please know I'm here to go through everything with you and answer all of your questions. Today, I'd like to discuss your baby's discharge plan in detail, covering his recovery at home. To start, could you share with me how you're feeling about him coming home today?
I'm very relieved the surgery is over, but I'm also quite nervous. I just want to make sure he's really ready and that I know exactly what to do. Is he okay to leave?
That's a very natural feeling, and part of my role is to ensure you feel confident. First, I can confirm that your baby is medically ready for discharge. His vital signs have been stable, his surgical wound is intact and healing well, and he's been taking adequate feeds. Before we go any further, I'd like to hear what specific concerns might be on your mind about caring for him at home. What are you most worried about?
Honestly, everything. How will I know if he's in pain? And the wound on his lip looks so delicate. What if it gets infected? Also, feeding him seems very daunting now.
Thank you for sharing that. Let's address each of those points, and Mihiraa, please stop me anytime if something isn't clear. First, it's important to know about some common temporary effects you might see over the next few days. It's very typical for babies to have some mild swelling around the lip and nose, and there might be a very slight oozing of clear fluid or a tiny bit of blood from the stitches. You may also notice he sounds a bit congested and that his appetite is decreased for a short while. All of this is part of the normal healing process. To keep him comfortable, we will provide you with age-appropriate pain relief, like paracetamol. It's crucial to give only the dose we advise, based on his weight, and to follow the timing instructions exactly to manage his pain effectively and safely.
Okay, that helps. And for feeding? He was breastfeeding before.
That's an excellent question. Mihiraa, it's one of the most important parts of his recovery. You should continue with his usual breast milk or formula, as his nutritional needs haven't changed. However, to protect the delicate surgery site, it is critical to avoid any pressure on his lip. This means you must not use his regular bottle with a hard nipple. Instead, for the next several days, you will need to use an alternative method, such as a soft-tip syringe, a small, soft spoon, or a specialized Cleft feeding bottle, which we will provide for you. This keeps the milk away from the stitches while he eats. When you feed him, always position him in a more upright posture than usual and offer the milk very slowly. This upright, paced feeding helps prevent choking and reduces discomfort by minimizing air swallowing. After every half ounce or so, pause to gently burp him. This careful, patient approach will make feeding a much more comfortable experience for him while his lip heals. Do you have any questions or concerns?
What about protecting the wound itself? He's always trying to put his hands in his mouth.
Protecting the wound is crucial for his healing. First, if prescribed, you will use soft arm restraints. Mihiraa, think of them as little sleeves that prevent him from bending his elbows, so he can't accidentally bump or rub his stitches. He may fuss initially, but they are a temporary, essential protection. You must also keep his hands clean and away from his face. For cleaning, we will demonstrate a gentle technique using a cotton swab dipped in sterile saline to dab, not wipe along the suture line, just once or twice a day to remove any crusting. To prevent infection, the core rules are to keep the incision clean and dry. This means avoiding ointments unless directed and patting the area dry after cleaning. Meticulous hand hygiene for anyone touching him is non-negotiable. Furthermore, for the next 1 to 2 weeks, I strongly advise avoiding crowded places like markets or public transport, as his immune system is focused on healing, making him more vulnerable. Now, beyond wound care, I want to address any other worries you might have. Mihiraa, what specific questions are on your mind about his care at home, perhaps about his sleeping position, how to bathe him safely, or the details of his follow-up appointments?
I hadn't even thought about crowds. Surely I'll take care of him. And nurse, will he have a follow-up appointment?
Yes, it is absolutely essential that we see him for a follow-up appointment, typically scheduled within the next week. This visit allows the surgical team to personally assess how the wound is healing and ensure everything is progressing perfectly. It's a very important step in his recovery journey. Now, before you leave, it is vitally important that we discuss the specific signs that require immediate medical attention. While some swelling and fussiness are normal, you must contact the ward or your GP immediately if you observe any of the following: a fever, which is a temperature over 38 degrees Celsius, excessive swelling or redness that seems to be spreading, persistent vomiting where he cannot keep feeds down, or if the wound itself appears to be gaping open or pulling apart. Also be vigilant for clear signs of infection, such as pus or yellowish discharge from the incision, a foul smell, or if he seems to be in severe, inconsolable pain despite the pain relief. Trust your instincts as his mother. If something seems seriously wrong, do not wait. Seeking prompt help is the safest course.
Definitely, I'll take care of him.
Now, to make sure we've covered everything clearly, let me just summarize our conversation. Mihiraa, we confirmed her baby is ready to go home, and we discussed the normal after effects like swelling and congestion, along with correct pain relief. We went over safe feeding methods using a syringe or soft bottle, keeping him upright and burping him. We talked about wound protection with arm restraints and gentle cleaning, and ways to prevent infection by avoiding crowds and keeping hands clean. We touched on other concerns like bathing and sleeping, and finally, we covered the need for a follow-up visit next week and the crucial warning signs that need urgent attention. Mihiraa, I wish your baby a speedy recovery.